Unable to use that right limb and is now dragging the left limb.
He's painful. He needs MRI surgery.
As she was able to walk in 3 legs, she seems off balance and sort of falling.
Hi.
Day in the life of a veterinary neurologist. Let me get the pink sheet. You can...
I have Moxie. She's a 5-year-old female spayed Dachshund. She yesterday started to have difficulty walking in the right pelvic limb. She was dragging her right pelvic after she jumped off the bed. Yesterday she was whining and crying when the owners picked her up. This morning she was unable to walk in both pelvic limbs. They went to go see Dr. Canada and she had referred her over here. She is non-ambulatory paraplegic, has mild to moderate motor in the left pelvic limb, nothing really in the right, but can feel the right pelvic limb.
Okay.
Not terribly painful on TL palpation, but a little bit tense. Cutaneous trunci cuts off at L1. Intact reflexes. Needs MRI plus minus surgery today. Gonna call. Bye.
Sorry. So what are our episodes like?
Swaying side to side of the head and forelimbs, lasting a couple of seconds. They don't notice any nystagmus, loss of consciousness. Still on fine.
You smell like a poodle.
Okay.
Heart sounds fine.
Yep.
Okay. Got it.
MRI.
Make sure that blood sugar is normal. MRI. It's normal. Viral acids.
Okay.
Rock and roll. I think there's a French Bulldog that should be getting here momentarily.
This is Toffie. Toffie is a 4-year-old male attack Frenchie. This morning, dog went down.
Okay.
Took it back to Coconut Grove, gave it an injection of Valium, and then they did a neural consult. Come on,
Not much there, kiddo.
come on.
He's painful. He needs MRI surgery.
It happened.
I'm gonna try really hard.
Fix that one.
I'm gonna fix all of them.
Yeah.
A little higher on the...
Do you see that? I mean, it's, but like when I'm doing it, we're getting a little bit on the left,
Okay.
but you don't really get a good one until there.
Okay.
Whereas on the left, we've got a pretty good one. So I
Gotcha.
definitely call her T3, L3, despite having that decreased withdrawal reflex.
Okay.
FCE, 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 and then all of the other stuff we said. ANNPE, IVDD. So yes, that's just something that often see that can be a curveball for people, just because we've got the decreased withdrawal reflex and people think it's an L4S3 localization, but when we have the cutaneous trunci cut off, this asymmetry, FCE and
Cool.
What am I looking for? I have these on, I have this on. Gloves.
Thank you. I'm gonna go...
Ratatouille was here for having these episodes of trembling. They're really, really brief. Our neurological examination was normal. On the MRI, we have kind of multiple little round punctate foci that are just these dark spots or voids on a sequence called a gradient echo. The gradient echo sequence is good for showing us things like hemorrhage or blood clots. So when we see these multiple little foci of blood clots or hemorrhages, we worry about, well, why are we having these tiny bleeds? Is it because of high blood pressure? Is it because we have leaky blood vessels? Is it because we have cancer elsewhere in the body? So no spinal tap, but what we're doing is we're going to be looking for those underlying causes. About half the time we find an underlying cause, about half the time we don't. What was it, piracy or hemorrhaging?
It was not. It was a little bit hemorrhage mostly fibrously. How's it going out there? What's happening?
Ratatouille had little micro bleeds.
Yep.
So we're doing the stuff for that. We're getting started on the Toffie.
Okay. What was the other Luna dog?
Looks like an FCE.
Okay. Are they gonna skin?
Yeah.
Cool. I have so many questions. No, that's it. Those are all my questions. Anything else coming? We're appendix?
There was something about a boxer with possible tetanus or a brain tumor.
Donna, 8-year-old spayed female boxer girl. She's been at SVRC for the last 3 days following episodes of severe excessive vomiting. She was starting to develop a little bit of a left head tilt and did not stand up anymore.
So I've met Donna. I understand we've been in the hospital for 3 days now. On Saturday, we were all of a sudden just kind of flaccid. We were falling over. That's happened a couple times. We have been getting some physical therapy from Dr. Sanchez for a couple months, but we've basically been in the ER for difficulty walking and having these episodes. We've noticed this sort of head tilt, this turning of the head to the left. She seems off balance and sort of falling. Specifically, I'm worried about a problem affecting the balance system. The balance system is kind of made up of two parts. The parts in the inner ear and then the part inside of the brain. I'm a little bit more worried about this being a problem inside of the brain just because of the not knowing where the feet are, the back left foot, and then the abnormal eye movements. They're kind of going up and down as opposed to side to side. So I can't be 100% sure, but that is my suspicion, is that this is a problem affecting the brain, specifically the balance system in the brain.
What happens if it's like in the brain? What can we do?
Well, it depends on what the underlying cause in the brain is. So we're suspicious that it's a problem in the brain, but we don't know what that problem is. That problem could be something like a brain tumor. Unfortunately, we do see brain tumors in boxers with a fair degree of frequency. There are other things that we can see though. Dogs can get strokes in the back part of the brain. Dogs can get infection in the brain. Dogs can get inflammation in the brain, what we call encephalitis. And even some medications, some toxicities can cause balance problems in the brain. In order to know what can we do, we need to know what the cause is. So that's where I recommend an MRI. So Luna looks like she had a fibrocartilaginous embolism. The hallmark presentation, it's usually a medium to large sized dog, acute onset of asymmetric spinal cord dysfunction, usually non-painful, usually non-progressive. That's what she presented as. She was able to walk in 3 legs, but the back right leg, there was no movement whatsoever. MRI supported that. What we typically see on the MRI for a fibrocartilaginous embolism is a intramedullary, so that means on the inside of the spinal cord, as opposed to like when we see a slip disc, it's on the outside pressing in. So intramedullary, hyperintensity or a bright spot. Usually it is not causing any sort of compression of the spinal cord. Sometimes there's a little bit of contrast enhancement, usually there isn't. And we did a spinal tap just because other things can look just like that with a bright spot within the spinal cord, but expecting the spinal tap to be supportive of an FCE as well.
What's happening out there?
FCE with Luna.
Cool.
Getting started with Donna. So we're finishing up Donna's MRI right now. Unfortunately, it looks like it's a tumor, so I don't see a stroke or an infection or inflammation or anything like that. It looks like a tumor. So this is Donna's MRI. This is a T2 weighted sagittal. So her nose would be over here. This is her brain. This is the back part of her brain. So this is her cerebellum. And it's a little, it should be kind of nice and round, and you can see it's kind of flattened at the bottom here and kind of pointing. This is the same plane as before, but this is a post-contrast T1 weighted image. If we think of her as a loaf of bread and we make slices, that's what this picture is here. And this slice is made right where this green line is. So we're looking at the brain here, and as we get back to the back part of the brain where the balance system is, we can see there's this bright or contrast enhancing mass that's sort of coming from the surface of the bottom left side of the brain, and it's pushing the brain up and towards the right. So this structure should be kind of right about here, but this white area is growing there and pushing up on it. Same thing here. So this is all being pushed up into the side. So for any mass, we can't know that it's cancer without a biopsy. This isn't in an easily biopsyable place. It's kind of right at the base of the brain, and there's ear and blood vessels, and it's just a very hard place to get to. So we're unlikely to be able to biopsy this to prove that it's cancer, but there's a type of cancer that commonly grows on the surface of the brain, and we often see it in this area, called a meningioma. There are a handful of other types of tumors that it, in theory, could be. Things like lymphoma, granule cell tumors, germ cell tumors, histiocytic sarcoma, etc. But the most common thing that we see is a meningioma. The owner's options right now are considering meeting with an oncologist for something like radiation to treat this, just because I don't think surgery is a great option for a tumor in this area, versus trying medications to palliate, sort of shrink the swelling around the brain. It's not going to kill any of these tumor cells unless it's something like lymphoma, but prednisone can help the symptoms. So they're going to think about things overnight. We're going to talk with them tomorrow morning after they've had a chance to think about their options.